Okay, let's go ahead and get started. um, Welcome, first of all, for the second in our cardiovascular series presentations this evening. This one's very interesting. I've done this one at the South Carolina Heart Center for years. It's really getting down to the basics of how your heart works, a level of detail that your doctor just quite frankly doesn't have time to explain to you. And a lot of times for patients, sharing that additional layer of information, becoming better informed about your heart, just basic function. We're certainly not going to go in depth, but understanding a little basic heart function and risk factors for heart disease and how they tie back to the efficient function of your heart, I think is very important, and I think allows you to better take care of yourself and those you love, and hopefully this will be very informative. So again, for anyone that wasn't here last week, a little bit about my background. I'm a cardiovascular physiologist by training. I went to the medical school at USC. I have a PhD in public health from USC as well. Was with a large cardiology practice in Columbia, South Carolina, the South Carolina Heart Center, for about 10 years, and developed several programs that became national programs, including the National Heart Health Program, which I now run and implement in hospitals and cardiology practices around the world. Well, let's start with the basics. There's honestly, there's so much information for patients today. Things have just changed so much, even just in the last decade, between information that our doctors are providing for us, information we're reading about online or in magazines or in health brochures, etc. Certainly television has more health-related educational programs, some accurate, some not as much. It all boils out to just a tremendous amount of data and information that a patient now is juggling that just quite frankly 20 years ago didn't occur. And that's really important when we talk about cardiovascular disease. Knowledge is power, and understanding your cardiovascular health and your risk and the function of your cardiovascular system, your heart and vessels, is very important for a patient, because again, the reality in America is that 50% of Americans find out they have heart disease by either having a heart attack or death. And that occurs for almost 50% of Americans. And really, that's an unfortunate statistic. And we'll talk about that a little bit in next Monday's presentation, using new technologies to prevent that from occurring. But it certainly is something that we don't need to tolerate, and certainly we can improve upon. So all this information that's currently available to patients, I hear it all the time, leads to confusion. And sometimes is a little bit overwhelming for patients. And honestly, that's why I like presenting on this topic to patients, just to kind of explain again, what are the basics of heart function? How does your heart work? How does that relate to disease processes or situations that you may be dealing with your own physician? And then let's talk about risk factors for heart disease. And why do we focus so much on managing these risk factors? And how do I improve my health in each of these areas? And that's what we're going to talk about tonight. So really, it really is just quite simply going back to basics. Let's boil it out. Let's give you kind of the Heart 101, if you will. Let's explain your heart's function, explain risk factors, and hopefully it'll make you a better informed consumer of cardiac care and in health. Again, as I said, knowledge is power, and certainly in healthcare that applies as much as ever. It really, we're seeing in the last 5 years in particular, patients are much more proactive than they have ever been before. They know more about their heart. They're seeing these, they're reading more. There's more online, internet, WebMD, things of that nature. Commercials from pharmaceutical companies, driving the patient to approach their physician about potential treatment options. All of that is a paradigm shift that we're seeing in healthcare. And really for you, the consumer, the patient, the ability to drive and control your own healthcare is very important. I like to use a very easy analogy and an easy comparison when you talk about your heart. and the different components of your heart and cardiovascular system. And really, it's just a simple comparison between your heart and your house. And they really line up quite nicely. Your heart has structural components, as does your house, like the foundation and the beams that support your house. Your heart has electrical components, as we're going to share, as does your house, the electrical system that's vital to keeping things going. And your heart certainly has a plumbing system, very much like your house. So again, we're going to see this very nice correlation between when you think about your house and the function of these units within your house. It's a very similar comparison when we look at our heart and our vascular system as patients. Let's start with the structure of your heart. The outside walls of the heart itself, as we all know, the heart is muscle. And in order to have a healthy heart, we need to exercise that heart so those muscles are toned and healthy and doing what we want them to do. And the muscle of the heart is very, very comparable to the walls in the house. The chambers, the heart is composed of 4 chambers, 2 atrials and 2 ventricles. And those chambers are very comparable to rooms in a house. The blood flows from one section of the heart, from one room to the next. So again, very comparable nicely to a house structure. And then the valves, which you can see in the diagram, control the blood flow. As the blood flows from one room, one chamber of the heart to the next, that valve opens and then closes to seal and not let the blood back the other direction. Those valves act as doors. Again, very similar to our house. Let's talk about structural issues now. Conditions that you may have been diagnosed with, or you may know someone, or your doctor may be talking about in your own health care. Muscle, the potential problems with the cardiac muscle itself is thickening. Primarily this occurs either from genetics or often from high blood pressure. And what happens is the heart, of course, has to work much harder to eject and get the blood out into the body when the blood pressure is high. I always like to use the analogy here of think of a garden hose and a plastic bag. If you had a plastic bag of water and you were going to squeeze it connected to a garden hose, the water would squeeze out quite easily. Now, if instead you connected a tiny little straw to that bag and tried to squeeze that same water out, it would be much more difficult to squeeze that bag and get the water to leave the bag. That's what happens with high blood pressure. As the vessels become smaller, the heart has to work much harder to pump the blood out into the vessels around the body. So that's what happens when it leads to thickening of the muscle. And what actually happens then is the chambers, earlier I said we can compare these to rooms in our house, the chambers then become too small. The muscle actually grows and starts making those rooms smaller and smaller, so less blood can be ejected with each heartbeat. And that's what we call ejection fraction. And you might have heard your doctor talk about that. It's honestly quite simply just the amount of blood that's able to be pumped in one heartbeat from your heart. And again, ejection fraction is very important. We want to make sure that we're getting a sufficient amount of blood out into the body to carry oxygen to the tissues that we need. And then last, but certainly not least, valves, a very common issue for patients when they have valve disorders. We've heard about patients that get artificial valves. We've all heard of heart murmurs. These are leaks when the valves don't seal quite tightly enough. When blood flows from the atrium into the ventricle, the valve is supposed to close behind it to keep that blood from coming backward and going upstream in the heart. When those valves become defective, it leads to either valve defects where we need an artificial valve or we need valve surgery, or leads to a heart murmur that we hear quite frequently. So those are kind of the structural issues related to structure of the heart. Let's move on to the electrical system. Again, I said our heart has an electrical system very similar to our house, and we have 2 what we call nodes in the heart, the sinoatrial node and then the atrioventricular node. Quite honestly, it's not important to remember the names of these, but these nodes are kind of the power centers. They're equivalent to the fuse box in your house. The fibers that branch off of those nodes are wires, essentially, that carry the electrical path. And when those nodes fire in the heart, it causes the contraction of the top two chambers, the atrium, to contract and squeeze blood into the lower section of the heart, into the ventricles. And then that other node, when the sinoatrial node stops, the atrioventricular node kicks in and it releases an electrical impulse and contracts the ventricles, and that pushes blood out into the body. Again, very well coordinated and timed, very important. If we don't have this electrical system within the heart will stop beating. So absolutely essential to life and heart function. The electrical system issues, things that we hear about from our doctor or among friends that we hear them with conditions. There are things like abnormal heart rate. Again, the nodes can be beating too fast or sending signals too slowly. Irregular heartbeat, which is a misfire in the timing between the two nodes, sending signals that cross up and we get an irregular heartbeat, which leads to the heart not contracting and not ejecting blood in the most efficient way. And even nodular failure, which is when we sometimes need things like a pacemaker or a defibrillator implanted. Those are things that we can potentially do as doctors to correct irregular electrical system issues. And then last and certainly not least is the plumbing system. And we can think of the veins and the arteries of the cardiovascular system of our body like pipes in our house. When the blood is forced from the heart, it's ejected. Of course, it's carried around the body by veins and arteries and eventually returned to the heart to start over, become oxygenated again and be pumped out again and carry nutrients and oxygen and vitamins to everything that's essential for life. Some of the problems that we have with the plumbing system, the veins and arteries of our body, can be weak spots like aneurysms. And again, I'll use an example of a garden hose. I think we've all seen this example where a rubber hose develops a bulge because of weakness in the side of the hose. You'll see a bulge, and that'll bulge like a balloon until eventually, if the pressure is intense enough, it will pop, and the hose is no longer functional. That's essentially what happens with an aneurysm. Either through a birth defect, just a congenital weakness in a vessel, or many times because of high blood pressure, we can cause these aneurysms where it'll actually cause a balloon to form in one of the veins or arteries in the body. And again, left undetected or untreated, this has the potential that it could burst. The second thing that can occur, much more commonly occurs, are blockages. The clogs that occur in the plumbing system, leading to heart attack and stroke. Again, we talked about this last week. We'll talk about it next Monday again in my other presentation on early detection of heart disease. But as these pipes become plugged with plaque, with coronary artery disease, they narrow, of course. And eventually, as they narrow, less blood can return to the heart. And if we have a clot, or it becomes completely narrowed and the blood can't get sufficient oxygen or blood back to it, the heart will have what we call a heart attack. Or if it's to the brain, it'll lead to a stroke. So those are the plumbing type issues that can occur in your cardiovascular health that you might have heard of or your doctor may talk about. So let's talk a little bit about risk factors and how they relate to these systems that we just heard about, the three basic systems of your heart and your vascular system. And let's find out why they really are important. You probably have heard from your doctors many times that we need to work on getting your blood pressure under control, or dropping a few more pounds, or getting your LDL cholesterol lowered. These are very important components of your overall health because they all, in different ways, affect your heart and your cardiovascular system and your function of your heart and your overall health. And we'll see why here. So let's start with a basic disclaimer again, that this information is general knowledge and certainly not intended as a substitute for your own physician's care plan for you. This is supplemental information to arm you as the patient consumer with more information to take back to work in collaboration with your doctor to improve your health. Let's start with high blood pressure, only because it's very common. Of course, millions and millions of Americans have high blood pressure or hypertension. And high blood pressure is, from a structural component, when we think again of the analogy of a house, it's the thickening of the walls of the heart. Again, because the heart has to work harder, that muscle grows thicker and produces less area within the rooms of the heart, the chambers, to eject more blood. And it just makes the heart work harder with every beat. So that's what high blood pressure does to the structural portion of your heart. From a plumbing aspect, when we talk about the veins and arteries of your heart, high blood pressure is very detrimental to your vascular system. Because of the high blood pressure and the force that the blood is coming out of the heart, it can lead to small tears in the walls of the arteries, which then allow plaque, cholesterol, and plaque to form in the damaged areas of the arteries and the veins, leading to blockages that lead to heart attacks and strokes. So that's why, from a plumbing standpoint, from an artery and vein related aspect, high blood pressure is very dangerous for the patient. We really need to get that lowered. The remedy to fixing high blood pressure is, obviously, it's very important to monitor your blood pressure on an ongoing basis. Blood pressure changes. It can change within minutes, much less hours, versus morning to night. It's important to create a log and monitor your blood pressure if you're facing hypertension, and bring this information back to your doctor. Your diet is very important. Lower your sodium content in your diet. Lower your alcohol consumption. These things relate to increasing blood pressure. Let's see here. Exercise, of course, lowers blood pressure, as does losing weight, and of course, prescription medication if your doctor believes that's what's appropriate. High cholesterol, the LDL cholesterol, is, again, the bad cholesterol in the body. This is what leads to plaque, to blockages in the arteries that leads to heart attacks. From a plumbing perspective, again, we want to keep that LDL, the bad cholesterol, as low as possible. The lower we can get that, the less likely that you're going to have to form plaque, to form blockages in your arteries that lead to heart attack and stroke. The remedy, the solution to that is diet, eating low-fat meats, exercising to clear that bad cholesterol out of your body. Again, weight loss, and if necessary, statin therapy, pharmaceutical therapy, again, if that's what your physician prescribes for you. Let's talk for a minute about the good cholesterol, the HDL. That's the good cholesterol that actually comes in and clears away the bad cholesterol we just talked about. The higher your HDL, typically the lower your bad cholesterol is going to be, because this HDL comes in and clears the bad cholesterol out of your body. So from a plumbing perspective, again, keeping the arteries and veins clean, we want to keep that HDL as high as we can so it clears the bad cholesterol out, preventing plaque buildups, blockages, which lead to heart attack and stroke. The best way to increase HDL is simply exercise. It's directly related to physical activity. As a patient increases their physical activity, the HDL goes up. Weight loss also will help, and quitting smoking, if you're a smoker, will also increase your HDL. Being overweight, obesity, we've heard it for years. We all know the story. From a structural aspect, being overweight causes the heart to work much harder, which again thickens those walls, leading to heart failure. The electrical system has to work much faster in someone that's overweight, because it has to pump much faster, again, to get blood to a larger area of the body. And globally, being overweight or obese increases all of your risk factors and makes it much more difficult to be healthy from a cardiovascular standpoint. Again, obviously diet, exercise, counseling if needed, and pharmaceutical therapy, again, if your doctor prescribes it, as a potential solution toward being overweight. Lack of physical activity, the structure of your heart is weakened due to a lack of physical activity. Your electrical system, your heart rate can be affected due to a lack of exercise and physical activity. And from a plumbing perspective, the veins and arteries, a lack of physical activity is directly tied to the forming of plaque and blockages, again, leading to heart attack and stroke. The way to overcome is a lack of physical activity is get out and do something. You don't have to run a marathon. You can walk. You can take the stairs instead of taking the elevator. It doesn't have to be something, a triathlon is not what we're asking you to do. It's just get out there 4 to 5 times a week and do something to start strengthening your heart and warding off the other risk factors. Diabetes, of course, there's a strong correlation between patients who have diabetes and heart disease. From a structure aspect of the heart, diabetes severely weakens the heart overall. From the arteries and veins, the plumbing portion, it affects the lining of the vessels, again, allowing that plaque to form, leading to heart attack and stroke. And again, prescription medicine for diabetes, well-controlled diet, exercise, and weight loss will all help you to avoid heart disease, particularly if you're diabetic or pre-diabetic. Tobacco use, everyone knows this already. It's very detrimental and negative towards your heart and vascular system. From a structural component, it weakens the heart overall. From the electrical system of your heart, tobacco use increases your heart rate. And from plumbing, it leads to toxins being spread through your arteries and through your veins and the vessels, leading to plaque formation, heart attack, and stroke. Again, smoking cessation and prescription therapy to stop, if warranted, are successful remedies for stopping smoking and improving your health. Inflammation is one that people may not recognize as much, but we're really recognizing this more now in the cardiovascular space. Globally, this increases your risk of all heart-related problems, but all disease processes as well. And inflammation is really a major culprit toward bad health outcomes. And a remedy toward reducing inflammation and the inflammatory process is really watching your diet, particularly sugar. Sugar consumption is directly related to inflammation around your entire body, leading to these disease processes that you can see on the screen. Stress reduction, potentially pharmaceutical therapy. Family history, this increases your global risk. Family history of heart disease. This is the only non-modifiable risk factor. It's the only thing you can't change. The good news is all the rest of the things I've talked about, we have the ability to change. This one, we can't, but if we can control all of the others and know our family history, and if we have a strong family history, share this with our medical providers and use the screening tests that are out there to early diagnose our situation, again, based on a strong family history, we improve our chances and our outcomes. So knowing your numbers, this is a website that I would encourage you to look at. This is a website where you enter your risk factors for coronary artery disease, for heart disease, along with your age, your weight, etc. And it'll estimate your risk of having a heart attack or a stroke for the next 10-year window. So a very nice tool for patients through the American Heart Association. Coronary calcium score, we'll talk about this more next Monday. This is an early screening test that allows us to non-invasively look at your coronary arteries very inexpensively, particularly if you have a family history, but any of these other risk factors to determine if you're at risk of having a heart attack and prevent that first heart attack from ever occurring. So very successful test and very guideline indicated test for patients. So I'm going to open it up. I see, according to my screen, we have about 3 minutes left. So I'm going to keep it brief for questions. I'm going to also encourage you very briefly to look on the BrightBod website and consider joining one of my support groups. That will enable you to answer questions that we may not have time to answer here in a live setting, but you can submit the questions and I will respond to you directly with the answers. And again, check under support groups. There's 4 of them related to heart disease and heart function. I'd strongly encourage each of you to check those out and join the groups if you'd like to ask specific questions. So we have 2 minutes left, and I apologize if we get cut off, but please, if there are any questions.
Hello?
Okay, I have unmuted you. I'm sorry, go right ahead.
Can you hear me?
I can.
I understand that drinking water frequently, especially in the morning, helps to lower blood pressure. How much water should we be drinking?
You know, they say eight tall glasses of water a day is the recommended guideline. And you are correct. Drinking water really does help globally with a lot of heart-related risk factors. So yes, very, very important and a great question.
But how much is 8 glasses?
Eight 16-ounce glasses. So a tall glass. So just think of about 10 cans of soda worth of water, okay?
Okay, I see.
That's your target goal per day.
Okay.
Okay?
Yeah.
Excellent. We probably have time for one more question. We have 1 minute.
Oh, go ahead.
Yeah.
Go ahead.
I'm a social drinker.
Yes.
I don't like red wine, and I know that's what's recommended.
Sure.
I have like about 2 or 3 glasses per week. Is that okay?
That's not a problem at all. No, that's unless your doctor tells you specifically that you have other health-related issues. From a cardiovascular standpoint, that's just fine. In fact, there's been many studies that show that moderate alcohol consumption, which that would certainly be considered, actually helps lower blood pressure and improve.